Did you know pregnancies start in the fallopian tube?
So what happens is when the intercourse happens, the sperm makes its way through the birth canal and the egg that's released from the ovary travels in the tube and they meet in the tube. Once the embryo is formed, there are little hairs within the tube that push the embryo into the womb.
Once the embryo goes to the womb, it embeds, and that's when the pregnancy continues and your baby slowly grows.
My name's Dr. Remy.
I'm Dr. Jen.
And together we are founders of Niara Health, a women's health education platform that serves to empower you with evidence-based medicine and bust all those myths you keep hearing in your WhatsApp chat.
Today we're going to be talking about ectopic pregnancies.
So these are pregnancies that embed outside of the womb. So the tube is the most common place it can occur. They can also happen on the ovary, in the tummy, in the cervix.
But some places are more common than others. So Remy and I work as obstetric and gynecology doctors here in the UK. We often see many women coming through the doors of our A&E or our early pregnancy scanning departments with ectopic pregnancies. They come in presenting with various symptoms, but mainly pain and bleeding.
And obviously a positive pregnancy test. So pain in early pregnancy isn't super uncommon. However, you should be aware of the signs and the symptoms of an ectopic pregnancy so that you can seek help early, because it is or can be a life-threatening condition.
So some of the signs include pain in your tummy that isn't getting any better. Another sign includes bleeding from the vagina.
If, for instance, the pregnancy has outgrown the tube and there's evidence of bleeding into the tummy, you can then feel faint, dizzy, lose consciousness, and have pain at the tips of the shoulders.
So if you know that you're pregnant and you have any pain or any bleeding, it's best to come into hospital to be reviewed.
Once you're seen by one of our colleagues, the most definitive way to make this diagnosis is to do a scan of the pregnancy. And this is typically a scan through the vagina where they can look at the ovaries, the tubes, and the small pregnancy.
We also do blood tests to check your hemoglobin levels and also the pregnancy hormone level as well.
If it's found that there is a pregnancy in the tubes or outside of the womb, there are a few treatment options, but the mainstay tends to be surgery.
Depending on how well you are, the pregnancy hormone levels, the size of the pregnancy, that will dictate what treatment options we can offer you.
You might have watched ER or Grey's Anatomy and there's a woman being wheeled in by an ambulance where she's lost consciousness, she needs to rush to theatre. Now this can be how an ectopic pregnancy presents, but the majority of the cases will come in, have a conversation, have a scan, and then have time to determine what type of treatment they will have. And if they have surgery, will it affect their future pregnancies?
Surgical treatment usually involves removal of the tube that contains the ectopic pregnancy. We usually do this to prevent you from having a future ectopic pregnancy in that same tube.
What this does though is it leaves one tube behind, which therefore increases your chances of being able to naturally conceive the next time. However, at the next pregnancy, because you've had an ectopic pregnancy before, you are at a slight increased risk of having another one, and an early scan is advised.
Absolutely. If you've had a previous ectopic pregnancy, then you're at a slightly increased chance of having it again.
Any sort of damage to the tubes can also increase the risk of having ectopic pregnancy. So the most common ones we see are evidence of previous sexually transmitted infections, chlamydia, gonorrhea, or pelvic inflammatory disease. Because what happens is if they're specifically untreated, they can plug up the tubes and increase the risk of a pregnancy getting stuck there.
Also, if you have a coil in place or you're taking the mini pill, this also increases your chances of having an ectopic pregnancy.
Interestingly, being a smoker will also increase your chances of having an ectopic pregnancy. If you find you're pregnant and any of these risk factors ring true, along with having pain in early pregnancy, bleeding, especially pain on one side, then we would definitely recommend that you seek advice earlier on and arrange for an early scan to make sure that the pregnancy is in the right place.
A common question we're asked is, why can't my pregnancy continue in the fallopian tube? The reason for this is The fallopian tube is a very thin structure that isn't designed to stretch. Pregnancy in the correct place, which is inside the womb, which is designed to stretch, will allow the pregnancy to grow. However, if it's found in the fallopian tube or anywhere else, these places aren't designed to stretch, and unfortunately the fallopian tube can tear and cause life-threatening bleeding.
Another question I've been asked by patients is, can't you just move the pregnancy to the right place? And again, this is not possible. Where the pregnancy has embedded, to take it from that place, you're disrupting the blood flow, and it's not possible for you to then encourage it to re-implant.
Thanks so much for watching our video.
I hope that you found this useful and informational.
If you have any questions, please leave them in the comment section down below.
If you would like more information, please check out our Instagram page, which has a catalogue of women's health information. Otherwise, we'll catch you in our next video.
Don't forget to like, comment and subscribe.